Okay, so I've got all my equipment that I need. We've done a sweep of the room. I've checked the MAR. I know exactly what I need to do with my patient. She's going to get a Foley catheter, a urine sample, and NG tube. So we will. So I know what I need to do and who my patient is, and I'm going to go in. Hi, my name's Dee. I'm going to be your nurse today. Can I get your name and birthday? Great, Barbara. All right. So what we're doing today, we're doing a Foley catheter. That's going to help drain your bladder for right now. Okay, wash my hands. I'm going to get some gloves on. Now with a Foley catheter, have you ever had one before? No? Okay. So I'm going to go step by step every little part of this with you. And Barbara, are you in any pain today? No? Okay. And do you know if you have any allergies? You don't have any allergies. Okay, that's great. So with the Foley catheter, it is inserted into the urethra, so down in your vaginal area. And so I want to make sure that I have your full consent to do this. I do? Okay, great. And then if at any point you're uncomfortable or you're in pain or there's something going on, I want you to make sure you let me know, okay? And I'm just going to step by step let you know everything that we're doing. Okay? Sounds good? Awesome. Okay, so first, I'm just going to get my stuff set up over here. Garbage. Okay. So first I'm just going to get you set up, okay? So I'm going to get the bed raised, bring you up to my level. Okay. I'm going to draw the sheet down, and then just to confirm, I do have your consent, correct? Okay, great. So, what I'm going to have you, I'm going to lift up this. And in order to do this properly, we're going to have you bring your legs out kind of like frog legs. Yeah, just like that. Perfect. Okay, we're going to do both sides. Awesome. And then I do need to let you know that we are going to be working with a sterile field. And so the best you can, I need to make sure that you don't move around. We don't want to mess up that sterile field. We're going to do the best we can to just prevent any sort of infection. So if it's hurting or if something's going on, just let me know so that I can stop what I'm doing. And we can adjust what we need to, but that way you can stay as still as you can, okay? Does that sound good? Okay, great. So, first I've got my wipes, my pretend wipes. Crap. I'm going to grab some wipes over here. These are from the facility. They are wipes that we are able to use them on the peri area. So first, I'm just going to kind of get you cleaned up. So I'm going to go down front to back using several different wipes, making sure I have the insides wiped. I'm going to get the legs clean, so we're cleaning all this area, just getting like a really clean area. So I'm using several different wipes, making sure that I'm not going over the same area with the dirty part of the wipe, and I'm using new clean wipes every time. So we've got you cleaned up, you're good to go. Is that okay? Is everything still okay? Awesome. Okay, so now I'm going to dispose of my gloves, put them in the garbage. I'm going to get this open first. This is all the equipment I'm going to be using, okay? And if you have questions about any of it, just let me know. So everything on this sheet is sterile, so I can't touch it at all. Okay, now I'm going to get my gloves on. And I have a 1-inch diameter. And I haven't touched this part yet, so this glove is still okay. I haven't touched the inside yet. And if it wouldn't have been, I would have grabbed a new pair of gloves and started over. There we go. Okay. So I don't want to touch the outside of that to my sterile film. Okay. So first, I'm going to get my glove on. Okay. Okay, good to go. This I'm going to throw away. I'm just gonna get a few things set up, okay? Okay, so first I'm gonna lay down my cloth. This is gonna go underneath you. I've got the shiny side down. I'm gonna tuck it under. Remaining sterile all the way, not touching anything. Okay, and then this is just gonna come just right over the top, okay? You still doing okay? All right, good. Okay, just right over there. Okay, perfect. Just gonna get a few other things set up. Okay, so I'm gonna put my lube just right here in the tray. Going to attach my syringe. Right here to that. Okay. Luckily, it fell in my sterile field, so everything is totally fine. I'm gonna put my syringe back on. Okay. Now that all that is good, this is going in the garbage. I'm going to take my cleansing wipes to clean. This hand will be unsterile after this. So I'm going to carefully, I'm still sterile filled, so I'm just going to bring it this way. Okay, so this hand will become unsterile. I'm going to go here, pull it apart. So it would be pulling apart the lips. I'm going to take my first one and go down the side. We're going front to back, discard. Second one, down, discard. Third one, right down the center, getting it nice and clean. And I'm going to leave my hand like this, not gonna let it close up. I'm going to grab my lubricated catheter and my kit. Okay. All right, Barbara, is everything still okay? Okay, so I'm going to take the tip of this. It's been lubricated to help with pain, so it slides in a little easier. Okay, so it might feel a little bit cold, a little bit of pressure. Let me know if it hurts. Let me know if you need me to stop. Okay, is everything still okay? All right, here we go. So I'm going to insert the catheter now. Okay. Good. Still feeling okay? No pain? Okay, good. All right. Now I've got urine. I can see the urine, so that means we're in. So I'm gonna go just a couple more inches in. Okay, perfect. I'm going to stabilize the catheter while I blow up the balloon. Okay, I'm gonna give a little tug. Okay, we're in good. Take that off. Put this back. Okay, take this out now. Now I'm going to go ahead and move this out of my way. My hands are no longer sterile, so I'm going to tape this to the side of your leg. Or if we had Velcro, I would use Velcro. So this would be secured to the side of the leg. This is going to go below and put on the bed frame a non-moving spot. Let's see. I didn't bring any tape in here. Okay, so this is secured right here, wrapped around Velcroed. All right, let's go ahead and you can put your legs back down now. And then because of the lubrication, I'm going to clean you up just a little bit, okay? So, my hands aren't too dirty, so I'm going to go ahead and just get my wipes and then wipe around again, side, throw it away, and you wipe this side, throw it away, and then down around this, and hold this, make sure you clean it, that it's nice and cleaned up. Okay, good to go? Awesome. I'm going to cover you up. Now, if you had had your catheter for a while and we were needing to do a sample, what I would do is I would be clipping this, and we're going to clamp that for 15 to 30 minutes, and then I would come back in and check. So I've got that clamped. I'm going to cover up. Okay, take my gloves off. And then I would put these away, hand hygiene, get some new gloves on, get all this taken away, thrown in the garbage. Reposition. Did you want to sit up? I can sit you up. Lower your bed back down. And you said you want to sit up a little bit? Okay. So I'm going to get Barbara sitting up a little. Okay. Perfect. So now I'm going to leave the room. Everything looks good. I'm coming back in to get a sample. So I'm going to clean this stuff up real quick. So I'll have my sample table ready. And I'm going to use this for the sample. Okay, so I've left the room. I know I need to get a sample now. She's been clamped for like 15 to 30 minutes. So I'm going to come back in, knock on the door. Hi, Barbara, it's me again. Because I disclosed her name, I'm going to check for other identifiers. So Barbara, what's your birthday for me? Okay, great. And then what is your home address? Awesome. I would also check her wristband, make sure it's her. Okay, great. So Barbara, while I wash my hands and put my gloves on, I am going to collect a sample from your catheter. It's just going to be real quick and easy. Okay, so I'm going to glove up. And then I've got my sample cup, and then my empty syringe that would be packaged and clean, because for this sample we need it to be very, very clean. I've got my biohazard bag that I'm going to need. So in order to do that, I'll just lay this here. Okay, so I'm just going to go ahead and lift up here. And I'm just going to take it from right here, okay? So I've got my syringe. I'm going to open up my specimen container first. Be very careful not to contaminate it in any way. I've got my alcohol swab that I have ready. And with my alcohol swab, I'm going to clean this area that I'm going to be pulling from. I'm going to clean it really good. Okay. And then I will have my syringe out of my fresh package so that it is still sterile. Click it in. And I'm going to be pulling 5 to 10 milliliters, at least 5. Preferably 10 if we can get it. Okay. Pull it off very, very carefully. I want to make sure that I get it directly into the specimen cup. Okay. And then this will be going in like a biohazard trash can because of the urine. I'm going to very carefully put my lid on. So this has been put in a biohazard trash can. It needs to be labeled with their name, date, room number, my initials, anything, the time, specifically name, date, and time, but anything else that the facility's policy needs, into a biohazard bag, and then we will be submitting it to the labs for what they like. All right, Barbara, I'm just going to unclamp here for you. Make sure you're comfortable. Okay, awesome. Are you good to go? Is there anything I can get for you? Okay, great. Well, I'll see you in a little while then. Okay. For the last thing I need to do is I have an order to remove the catheter. So, for the sake of saving gloves, I think we might have enough gloves. But I had removed my gloves. Well, okay, I'll just show them. We should be okay. Okay, so now I know that I need to remove the catheter. So I'm going to have my materials. I think I just need a syringe. A syringe. Okay. So I'd be removing the I know that I need a syringe to deflate it. So again, I've checked my MR, I know what I need to do. Knock on the door. Hello, it's me again. My name's Dee. Can I get your name and birthday? Okay, great, Barbara. So we get to remove your Foley catheter today. If you have any questions about that, just let me know. So you no longer need it, so we're going to head and get it out for you, okay? Perfect. So I'm going to wash my hands, put on some gloves. Okay. So I've got this up in it. I've got my packaged syringe that will deflate it, and then the towel that I'm going to put underneath her. Okay. Going to bring my tray over. Okay, so again, this is packaged, so putting it down here isn't going to contaminate it or anything. Okay, Barbara. So first, I'm just going to lay you back just a little, okay? This is going to help make you more comfortable, all right? And again, if you're uncomfortable, if it hurts, anything like that, go ahead and let me know, okay? And I will stop right away. Okay. So, I'm going to have you open your leg skin just a little bit. Perfect, just like that. I'm going to inspect, make sure everything looks okay, that there's no like irritation, swelling, things like that. Make sure that it looks okay so that we don't have any issues when we're removing the catheter. Okay. First, I want to empty my bag, and so I would have my specimen cup, or I guess just like my cup to empty. I might have my clean cloth down here, lay it, empty the bag, set it on a flat surface, and then I'm going to measure my output, and I'm going to document my output before I remove it. Okay, so once I have removed it, I'm going to go ahead and get this, unpackage my clean new syringe. Okay, I'm going to go ahead and deflate your balloon, okay? All right. There we go. Perfect. Okay, go ahead and take a deep breath for me. It might be a little uncomfortable, but I'm going to get it out, okay? Perfect. Okay, you did awesome. Now I'm going to get this and throw it away in the biohazard. Both of these are going to be thrown away in biohazard because of the urine, so that's going to be tossed. What I forgot to do that I would have done is I would have actually laid this towel underneath her first, and that would be to catch any drippage, any urine, anything like that. So that would have been laid down first before I took out the catheter. So done that, everything looks good. Before I do anything else, I'm going to actually clean you up just in case there was anything that got on you. So I'm going to, with new wipes, go down the side, new wipe right down the front, and then make sure you're nice and cleaned up. All right, wasn't too bad, right? You did awesome. Okay, so now I'm going to I'm going to cover you up. And then you said you wanted to sit back up, right? Okay, I'll go ahead and get you sat up then. Okay, perfect. Well, I'm going to go grab some equipment because we're going to place your NG tube today as well, okay? Does that sound good? All right, we'll talk about it when I get back. So, I'll now be placing the NG tube. So I'll look at the orders, I'll go to my MAR, I'll make sure that I get all the equipment that I need. Okay, so I've got this, I'm going to need, okay, so I will have gathered all the equipment I need for this. Knock on the door. Hello. All right, I'm back. So like we talked about, Barbara, check your your wrist, make sure it's still you. Okay, like I talked about, we're gonna place an NG tube. And have you ever had an NG tube before? Okay, so it's a nasogastric tube, and so what it's gonna do is it's gonna go up through your nose, down into your stomach. It can be used for like decompression, for like suction or feeding, things like that, okay? So I'm gonna go ahead and bring my stuff over here again. When I came in, when I identified, for the sake of gloves, because we're getting super low, I came in, I hand hygiene, and I put new gloves on. So these are fresh new gloves that I put on, okay? All right, Barbara, so to get started, I'm gonna go ahead, first I'm gonna sit you up, okay? 45-degree angle. Okay, there we go. Are you comfortable? Okay, great. So I'm gonna get my things set up. So in order to place the tube, I've got my cup of water and my straw for her. I've got my tape to secure it, some lubrication to help it go down. So I'm gonna open up my package. I've got a towel, I'm just gonna lay it right here for you, okay? That way we don't get anything on your clothes. Okay, so we've got the towel. I'm going to measure for the length of tube that I need for it to be inserted. Okay, so in order to measure, first I'm going to go from the nose to her ear, and then from there down to the bottom of the sternum, okay, right here. So I've got about 51. I'm going to mark this with my marker so that I know how far I'm going down. Okay, so I've got that marked. And then, Barbara, have you had any surgeries or head traumas? No, you haven't. Okay, great. So just want to be extra careful of that. So I'm going to change my gloves, take off my old gloves, and put new fresh gloves on to do the procedure. So first, I'm going to get my tape set up. Just kind of get this ready to go. Okay. I'll put this right here, okay? I'm going to move this pillow. It's going to help with the angle we want for your head to be at. Okay, there we go. Okay, now I'm going to get the lubrication on the tube. Okay. Okay, Barbara. I've got this cup of water and straw for you, okay? Just have you take little drinks of it while we do this, okay? Okay. If you're feeling any pain, if it's uncomfortable, just let me know. I'll go slow, and I can stop if it hurts. You just tell me to stop, okay? So we're gonna do it very carefully and slowly, okay? So I'm going in a little bit cold. That's all right. Good job. You're doing awesome. Awesome. Okay. Okay. Go ahead and bring your head a little bit forward, chin down. That's going to help. That's great. You're doing so good. Awesome. We're almost there. You doing okay still? Okay. So she's still able to hum and talk or make noises, and there's no signs of cyanosis. So I have to my mark right here. Okay, good. Is that okay? Is that still comfortable? I mean, as comfortable as it can be. Okay, so now what I'm gonna do is I'm gonna take my syringe, the syringe that I brought for the aspartating. There it is. Okay, so we'll check with an x-ray, but I do want to aspirate first and test for the pH, make sure it's in the stomach. So I'm able to do that, and I check my strip. I am in fact in the stomach. I've got the pH. Okay, and I did slightly secure this for now. Okay. Great. so now that we do have the pH, I am going to mark where it's at, so I'm going to take my marker and mark right where it's at. Okay, awesome. Now I'm going to take my gloves off, call for an x-ray. Hello, this is Dee. I've got Barbara here. I just put some NG tube. We need an x-ray stat. Awesome, thank you so much. Okay, and then I'm going to put my gloves back on. My gloves are back on. Okay, so I'm going to make sure that I get a good barrier cream in place around her nose. I'm going to move this out of the way now, or I'm going to actually keep this. So with my new gloves, I have barrier cream on my hands, so I'm actually going to take them off again, put new gloves, do some oral care, some mouth oral hygiene, get her taken care of. I've got this that is pinned. I would take some tape and a safety pin, and this would be pinned to her clothes, just to her gown right here to help it stay secure. Take this away. If it's what was ordered, I would be hooking it up to our suction, which is going to be low, intermittent, or whatever the order calls for. Have this. Let's see. All right. Well, oh, there we go. Maybe. Okay, so this would be hooked up. If that's what the order called for, make sure she's comfortable. How are you feeling? Is there anything I can help? Is there any pain? Are you feeling okay? Okay, are you comfortable sitting like this, or do you want to be adjusted? No? Okay, great. So, I'm gonna, before I take my gloves off and wash my hands again, I'm gonna collect everything, throw it away, readjust, get her bed put back together. Okay, do you have any questions for me? No? Okay, sounds good. Well, I'll be back later with your medications. Okay, so the last thing I need to do is there's been an order to take her NG tube out, and so that's what I'm going to do. And so I've checked, made sure that I've got everything I need, so I knock. Hello, it's Dee again. Can you confirm your name and birthday? Okay, great, Barbara. Just going to wash my hands. Perform my hand hygiene. All right, we get to take this NG tube out for you. Yeah, I know, I bet you're excited. Perfect, so let me just gather my supplies. Okay. So I got my towel, really on that, okay. So let's get started. So first, I'm going to disconnect all of the equipment. So take this off, turn that off, take it off. I want to make sure if I've got fluid in here, I'm measuring the fluid. I'm going to lay my towel down. And Barbara is at a good position. Okay, and I'm taking off, I've unclipped it from here, from her clothes, and I'm pinching it off. And then I'm going to take this off your nose, okay? Try not to hurt you at all. Okay, so now I've got it pinched off. Now, I've got a basin here for you and a tissue. So if you feel like, you know, it's making you gag a little, throw up anything, I've got this for you. Okay, great. And then tissue as well, okay? Excuse me. And then I've got my rag as well. Okay, we're gonna go slow so it doesn't hurt. And we're just gonna get this thing out of you, okay? Okay. I'm gonna hold it here. There we go. Good job. Doing great. We're almost there. Doing so good. Good. All right, yeah, go ahead and cough. Awesome. I'm going to throw this away. Good. Awesome. We're all done. Okay, go ahead and take this from you. Get a wipe or a tissue. Kind of clean her up with my tissue. Let her clean herself up as well. And good. Cough it out. Take this away. Okay. I'm gonna go ahead and take off my gloves, hand hygiene, make sure that Barbara's comfortable. Do you have any questions for me, Barbara? No? Okay, well you did so awesome. Took it like a champ, and if you need me, just go ahead and push your call light, okay? All right, you wanna stay sitting up? Yeah, okay. I'm just gonna lower you down just a little bit, and then give you your pillow back. Okay, great job today, and I'll see you back in a little bit.